Hello students, myself Dr. AshokRana, MD Medicine. Today I will be talking about acute renal colic. This is important topic as far as your clinical practice is concerned, as well as in your general examination patients where other causes are to be ruled out. So very commonly seen in emergency situations, such type of patients coming with severe pain abdomen. So it is one of the topics under the heading of severe pain abdomen or abdominal colic. So please subscribe to my channel before going further. Dr. AshokRana, which is available on the Android platform Play Store. Subscribe to it and then look for other videos which are present for you regarding your syllabus. Now coming to the topic of the day, that is renal colic. Renal means kidney, colic means pain. Now as you know, the urinary system comprises of a pair of kidneys. This is pelvis, ureter, urinary bladder and urethra. These are calyces, upper, middle, lower. This is pelvis of the ureter. This is ureter. This is pelvic-ureteric junction. Pelvic-ureteric junction. In short, it has PUG. And then it comes down, the ureter comes down and opens in the bladder. This is urinary bladder. Before opening into the urinary bladder, the ureter is at the narrowest lumen. Here is the narrowest lumen. So this is vesico-ureteric junction. This is the common place where the stone gets impacted. So two places where when the stone gets impacted causes lot of pain in the patient. So I will show you this. This is kidney left and right in male and female. These are ureters coming down and ureters. This is bladder, urinary bladder and then urethra. In females also, two kidneys, ureter and then urinary bladder and then urethra. So this is the genito-urinary system, you should say. Genito is total system, but we are discussing with urinary system. So now first write down what is the definition of renal colic. It is defined as severe spasmodic pain in the flank of abdomen. Flank of abdomen means this is the flank. Here below the ribs is flank of abdomen, lumbar part of the abdomen. In the flank of the abdomen, occurring all of a sudden, associated with nausea and vomiting due to renal calculus or calculi present in the urinary tract. So when the calculus, single or multiple, are present in this urinary tract anywhere, they may cause renal colic. It usually the pain lasts for 20 to 60 minutes or maybe up to 2 hours, and it is very severe in nature patient doubles up with the pain and it is quite impossible to control the pain without sometimes using narcotic analgesics. Now this pain is due to the peristaltic movements of the ureter, which leads to severe pain. The movements of the ureter try to remove the stone from the ureter, but in this process it leads to lot of pain to the patient. Now what is the root of the pain? Root of the pain, from where the pain starts? Costovertebral angle. Costovertebral angle, as I told you, this is costovertebral, behind, in the posterior part. In the posterior part of the patient, I will draw a diagram here. Now this is vertebral column. These are ribs. Now here is costovertebral area. यहाँ पे खत्म हो गई ribs. And this is vertebrae. This is the area of kidney. So the pain starts from the costovertebral angle in the back. From here in the back, this is costovertebral angle and runs along the anterior abdominal wall. Now see, this is the costovertebral angle here. It starts from here and goes down like this. It starts from here, goes down like this into the anterior part of the abdomen up to the groin, and maybe up to the testicle or tip of the penis in males, or in females up to the labia majora. This tract is very important because in most of the patient the root of pain is like this. This root of pain or severe pain like on this root is because of the obstruction of the ureter by a calculus, which has impacted into the area which is narrow, that is pelvic-uretary junction, vesico-uretary junction, or even at the upper level of the pelvis ureter if the stone is of bigger size. Now what is the incidence of renal colic? 5 to 15% of population suffers from renal colic. Now what are the qualities of stones? Stones are caused by crystallization of various salts which are present in the urine, and they form aggregates of masses leading to stones in the kidney calyces, and then they travel to the pelvis and ureteric system. Now the common causes, as I told you, the site of obstruction are ureteric, pelvic, this one, then pelvic ureteric junction, ureter, vesico-ureteric junction. So these 3-4 sites are important sites of obstruction of pain. Now what are the various complaints of the patient? Besides the complaint of severe pain which travels from the flank of the abdomen to the anterior abdominal wall up to the testicle or penis or groin, or in females labia majora, other features are hematuria. That means patient looks at the color of the urine, it is red in color. It is because of presence of blood in the urine. Then painful micturition. Because of the blood and because of the injury by the stone, if that stone might have passed, a small piece might have passed before it, that may lead to injury in the urethra, and that can cause the painful micturition. Then third complaint is increased frequency of micturition. Patient passes urine so many times in a day. After every 15 minutes to 30 minutes, he passes the urine. It is because of the infection caused by the passage of blood and infected urine. Urgency, that means patient has to go to urine, otherwise it may get incontinent or it may pass into the undergarments. And then burning micturition. Patient may also complain of burning micturition in the urethra. So these are important symptoms and signs of renal colic. Most important is pain, which is very severe, spasmodic, associated with nausea or vomiting, and that may last for 20-60 minutes to 2 hours. It is having sudden onset. Second is hematuria. Third is dysuria. Fourth is urgency. Fifth is burning micturition. And sixth is increased frequency of micturition. The important evaluation for this type of pain in a patient can be: first is urine examination to see whether the patient is having RBC in the urine, pus cells in the urine, or any other crystals. So this is in the urine examination. Then second important test is ultrasound of the abdomen to find out the site of stone, where it is present, whether it is causing obstructive changes in the form of back pressure changes leading to hydronephrosis. Suppose there is a stone here, it is causing obstruction to the flow of urine, then the ureter above this area, I will go with the other, ureter above this area gets dilated, as well as the kidney gets dilated. This dilatation and back pressure changes in the ureter and kidney are known as hydronephrosis and hydroureter. In the kidney it is called hydronephrosis, and in the ureter hydroureter. Now this hydroureter will depend on the site of the obstruction. If the obstruction is here in the vesico-ureteric junction, then the ureter above this is also dilated, like this. So this will be on the ultrasound examination. This gives rise to the diagnosis of ureteric stone. Now to further confirm this fact, we can go in for renal CT scan or MRI that will finalize the diagnosis of kidney stone, and depending on the size and the placement of the stone, the patient's management is available. Now first of all, we are to treat the management, how to manage such a patient. First of all, we are to control the pain. We are to give some analgesic injection in the form of diclofenac, piroxicam, or such injections, plus antispasmodics like buscopan or dotaverine, etc. Then if the patient is not getting relieved with this non-steroidal anti-inflammatory drug, then we may have to use Fortwin or Atarex or Fortwin Finargan or tramadol injection for the control of pain. Now if the patient also has pus cells in the urine, then we have to use antibiotics to control the pus in the urine. And a follow-up measure is required if the patient passes stone in the urine. We are to analyze the stone, which type of stone is, and accordingly we can advise the patient regarding diet, regarding his lifestyle. Usual stones are of calcium oxalate, or second is calcium urate or pyruvate stones. These are uncommon stones, and mixed stones are very common. So calcium oxalate, urate, calcium phosphate and pyruvate stones, these are the types of stone which are usually encountered in the renal stone patients. So after getting the analysis of the stone, we can advise the patient regarding the dietary and treatment for these salts, so that they may not crystallize again in the ureter. But beware, such patients are having recurrent stone formation. So in the long run, they should be advised about prolonged or increased intake of water, so that they pass increased urine and no crystallization of urine occurs and stone formation is avoided. So again, I will request you to download my app from Google Play Store, Android, that is Dr. AshokRana, and subscribe to it and purchase the course to find what are the other various courses which are available. Now, thank you for watching this video. Please like this video and give your comments on this video. Thank you.